All right, welcome everyone to Project Echo Care of Older Adults. We are presenting today in collaboration with the Kentucky Coalition for Healthy Communities. We do appreciate you being here. A few technology tips. If you could, we're going to invite you to turn on your cameras. It really does help make a better sense of community. But also, if you ever have comments or questions, you're welcome to unmute or use the chat feature. If you ever want to raise your hand, there's the raise hand feature. So I do appreciate you turning on your cameras if you're able. Also going to say if you have a name on your Hollywood Square and you do not is not yours, you can rename yourself. Going to invite you to add your organization next to your name if you'd like. So today I'll let you know a little bit about the University of Louisville Trager Institute. Our mission is to help individuals optimally age throughout the lifespan. We focus on workforce development, practice transformation, and community transformation. We have the Optimal Aging Clinic here in downtown Louisville, but clearly we have many programs that are available virtually, and we'll talk a little bit more about that at the end of today's session. Mona, are you able to unmute and talk about the Kentucky Coalition for Healthy Communities? Chelsea, do you mind stepping in and introducing the KCHC? Okay, well, we seem to be having a couple technical difficulties, but the Kentucky Coalition for Healthy Communities we've collaborated with for many years. The goal is to create community support systems for older adults in partnership with existing local coalitions and organizations. So if you are a coalition or a part of coalitions, we encourage you to invite them to join us, but it's to develop the workforce and concerned community members to empower our communities to become healthier. So today's session really shaped around lifestyle medicine principles and age-friendly healthcare principles. So really focusing on whole food, restorative sleep, social connection, regular physical activity, risky substances, and stress management. And when we think about age-friendly healthcare, thinking about what matters most to the people we're serving, their mobility, mentation, and medications. And so really keeping all of this in mind as we're working with older adults and really anyone we're enacting this for ourselves and for the people that we're providing care for. So this is our upcoming schedule. Won't want to miss our conversation in May. Dr. Laura Morton is presenting Pulling Back the Sheets on Older Adult Sexuality. In June, we'll have nutrition and social connection, the power of shared meals. And in July, we'll be focusing on incontinence. So really hoping you'll come back and join us. And you can do that through your iEcho account. So no need to register for future sessions. A little bit about Project Echo, if you're unfamiliar, it was founded in 2003 by Dr. Sanjeev Arora. He developed this telementoring platform to move knowledge, not patients. He was a hepatitis specialist and had learned a cutting edge treatment that hadn't been widely distributed in New Mexico, realized he couldn't possibly go out and train everyone and people couldn't all come to him to be treated. So he developed this telementoring platform to build capacity in local areas using case-based learning and teaching best practices in interdisciplinary team-based care. So do appreciate being part of this network. So today's attendees can receive a certificate for 1.5 hours for today's session by completing the evaluation at the end. If you're a community health worker or a social worker, you must complete the evaluation to receive continuing education. Community health workers, we're approved for 1.5 hours of continuing education, and the same for social workers. If you'd like to learn more about the great online learning opportunities available at Brescia University, there's a QR code down here in the bottom, and we do appreciate both organizations for helping us with continuing education. So today's didactic presentation is going to be presented by Kristen Neises, Gardening for Health, Movement, Nutrition, and Connection with Nature. So really appreciate you being here today, Kristen, and I will turn it over to you.
Everyone, thank you so much for being here. I apologize for actually that lighting for guideline that group. So, but thank you for being here and letting me here today. Talking about something that's simple, but really power and whatnot for not just as a hobby, but really as a tool to across this virus. Am I coming across okay? So
No, it's really broken up, Kristen.
You move. Does that seem to be any better?
That's totally better.
Okay, perfect. Okay, so we are going to be talking about gardening. We can go to the next slide, Justin. And first, I want to talk about why this even matters. So we work with older adults. I'm sure many of us are aware of the problem of the chronic condition incidence in older adults. 90% of adults 65 and older have at least one chronic condition, and many have several conditions. And we're seeing really the same challenges over and over, and that is not enough movement, poor diet quality, social isolation, chronic stress, and these all feed into each other. And so what we really need are interventions that are simple, meaningful, and also sustainable. And gardening is one of those rare things that kind of checks all of those boxes. So this is why I love gardening. It really is basically lifestyle medicine in action. Without feeling like a prescription, it naturally touches many of the pillars of lifestyle medicine. So there's movement, there's nutrition, quality nutrition, stress reduction. There can be social connection and time in nature. And it doesn't often feel like work to patients. It feels like something that is enjoyable and purposeful. So let's start with the benefits for physical health. So gardening provides that light to moderate activity. So when we're looking at the guidelines for older adults, we're looking for 150 minutes of mild to moderate activity each week, ideally. And so that gardening fits into that level of activity. But it's also functional movement. So people are digging, they're carrying, they are reaching, they're balancing. And because it's so purposeful, people are more likely to stick with it. There's also evidence suggesting that it may reduce falls risk, which we know is a huge problem for our older adults. So some great physical benefits for older adults with gardening. And then one of the most powerful parts of gardening is how it can positively impact nutrition. So people who tend to gardens tend to eat more fruits and vegetables. It improves access, especially in those rural areas or food insecure settings. And it naturally leads to more home cooking, which tends to be more nutritious. But the key idea here is ownership. So when people grow something, even if it's something small, they're much more likely to eat it. And that connection to food can really be a major behavior change lever. And gardening is just as powerful for mental health. It helps reduce stress and anxiety. Being in nature actually has been shown to reduce cortisol levels, the stress hormone. It improves mood. And there's even some research that suggests that the microbes in soil can play a role in serotonin production. So those are our feel-good hormones. And it also gives people a sense of purpose, which is so important for older adults going through so many life transitions. And it also keeps the brain engaged because we're planning and problem solving to grow our garden. And then the next topic is connection, social connection, something that we may not talk about enough, but really gardening can be a great tool for social connection. So lots of community gardens, which I'll talk about more in a minute, but that is some built-in social interaction. It's also something that families can do together across generations. So growing up, I gardened with my mother, my papa, and learned so much, and that was such great connection. And that shared purpose really does matter. We know social isolation has serious health consequences. So this really is can be a real medicine for longevity and quality of life. And just want to pull this through to the age-friendly framework. So gardening really does fit naturally into that framework. So we're looking at mobility through the functional movement. We have improved mood and cognition. So touching on meditation. We're looking at purpose and joy and autonomy for what matters. And then the potential to reduce the need of medications over time through those lifestyle improvements. So touching on medication. So it's not something, it doesn't have to be something extra. It really already aligns with what we're already doing. So we do need to acknowledge the barriers here. So many of our patients do have limited mobility. They may have pain or arthritis that makes it difficult to garden. Many may have a fear of falling, mobility issues, or even just the fear. And then limited space. Maybe they don't have a yard, or they're living in an assisted living facility. Or they just don't know where to start. They have a lack of knowledge and don't know where to start. So these are obviously real barriers, but the key point is that they can be modifiable. So we'll talk about that. So gardening can be incredibly adaptable. We can use raised beds to eliminate bending. I'm currently 7.5 months pregnant, and so bending over is getting harder and harder for me. And I know I'll have less time to be out in the garden when she's born. So we're doing a lot of container gardening on the deck this year. So container gardening is another great option. And vertical gardening, both for great if you have limited space, limited yard. Also seeded gardening. And there's several adaptive tools out there to assist with gardening. So the goal really is to meet people where they are and not force really that traditional version of gardening, but help them think outside of the box if it's something that matters to them. So how do we start? I say start small. One plant is enough. When a way to approach it is, could you start with just one herb this week? So no yard, no experience, just a small pot and some sunlight and some water, right? And this can really create that daily ritual and also a quick win, which is really how the behavior change starts, having those nice wins. We can go to the next slide. All right, so the good news is that we really don't have to do this alone as clinicians or people who are working with older adults. Lots of resources out there. So here in Louisville and Kentucky, we have we have great resources. Louisville Grows is a great resource for urban agriculture, lots of educational tools, also some food access programs. The Louisville Metro Community Gardening it has a lot of different community gardens and also, again, more resources for people. Local farms, our extension offices, both Jefferson County and the Kentucky Co-op Extension. Also want to mention public libraries. I know our Jefferson County Public Library System has a ton of gardening classes and resources. The Waterfront Botanical Gardens, Udell Botanical Gardens, even garden shops like Above the Dirt Garden Shop in J-Town, all have classes and are really willing to help people learn how to do it. And then local farms. Farmers are very helpful in encouraging of others to grow food and to farm. So like Fox Hollow Farm in Oldham County, I actually volunteer there and I'm able to learn. And they're always willing to help lots of farms in the area. Berry Center in Henry County is another great educational resource for farming as well. So lots of resources. Our role is really just to connect patients or clients to these existing supports. And then again, this is just to point out that gardening doesn't have to happen at one's home. There are community gardens, senior centers, faith-based programs, intergenerational programs. So these settings can give you the space to garden and the resources, but also amplify those social benefits that are so good for our health and for longevity. So just listing some of these resources again, if oftentimes it can feel overwhelming. So just simplifying by here's where you go next to find these resources. Want to also point out the Senior Farmers Market Nutrition Program. So vouchers for older adults to purchase fresh local produce from a lot of the different farmers markets in the area. So great way to get connected, but also to purchase some of that good produce. All right, and so then this is where we come in. We don't have to be gardening experts. I'm certainly not, but we just have to open that door for them. So that might look like asking what matters to them, suggesting gardening as an option. Might not even recognize that gardening could be a great option for meeting those physical activity recommendations. And then starting small, recommending that, connecting them to resources, and then following up that one suggestion to garden can really be a catalyst for a lot of different behavior change. So with lifestyle medicine, we don't just talk about what's good for our health, but it becomes the interventions that we prescribe for people. And so when we're looking at prescription for gardening, it could look like grow one herb or spend 10 minutes outside daily, visit a garden or a farmer's market, or add one homegrown food weekly. The key is making those goals, those interventions feel achievable, so that they can get those wins. And just want to talk about a quick example here. This is Mary. She's 72 years old. She has arthritis, depression. She started with just one herb on her windowsill. She got excited about it, watching it grow and taking care of it. Started adding it into her food that she was cooking and trying to cut down on some of the more the spices and stuff that were had more sodium in them. So using them for flavor. And over time, this just gave her some good little wins. And over time, she wanted to have more wins. So she started increasing her activity level, started using a recumbent bike at home. Her mood improved. She was starting to become less socially isolated, and she started cooking more. She was excited about what she was creating. So this is what we want. This is maybe an extreme example, but really those small sustainable changes can really build up over time and cause some really great change. So to summarize, I just want to say that gardening may seem simple in terms of an intervention, but can be really powerful with a lot of health benefits, impacts multiple areas of health. It's adaptable for almost anyone. And we as clinicians or those working with older adults are often the starting point to having these conversations with them. So sometimes the smallest suggestion really can create the biggest change. And then I would just like for you to think about this in your own practice, whatever your practice is. Is there a patient or a client that you could suggest this to? Is there a community resource that you could connect them to? Could this be a part of a program that you're building? The garden doesn't need to be grand. It just needs to be growing. Love to hear your thoughts. If you want to put those in the chat, feel free to share those. And I think that is it. If there are any questions.
Thank you, Kristen. So I'm wondering if people have immediate questions, and if not, then maybe we can look at Christian's reflection questions and kind of brainstorm ways that we could integrate this. So any questions?
Hi, Kristen. It's Sam. So I love this. I was saying before you jumped on that I was really excited about this presentation or didactic for today's Project Echo. But I was wondering, one of the questions that I sort of have is, have you seen any evidence out there about the connection between healthy, specifically helping people who might benefit from gardening and seeing how they can use that in, maybe making healthier nutrition choices as well. Because to me, that seems like there would be a really strong coordination or, collaboration there between your thought process. Oh, I grew this myself, let me eat this, and that's going to obviously be a healthier behavior.
Yeah, so there is a lot of evidence that when you're connected to the food, when you're part of that process, you're more likely to consume it. So if you're looking at growing fruits and vegetables, especially if you're where they're coming from too, what they're being exposed to, so not just the nutritional value, but also the exposures to certain toxins that can be in some of the food, you're more likely to consume it and get those benefits. And Mona, that's a really good point too. Excellent for evidence for children as well. When they're part of growing those foods, they're connected to it and more likely to get them to eat those vegetables that they may not want to. And I even recognize that in my own childhood with my mom having a big garden every year and helping her with it and always wanting to eat those vegetables. So, but there is strong evidence of it as well. And then also I'll say, even if you're not able to garden a lot of different vegetables, because we do really want to encourage people to get a variety of different fruits and vegetables in their diet to get different nutrients. So taking advantage of those, some of those senior voucher programs and becoming, and there's also even like low income discounts for like CSA programs. And so being exposed to different vegetables that you might not normally choose and getting a recipe that includes those can open doors to eating things that you might not normally. So getting some more nutrients. Those are great programs to take advantage of. And I know one of the ones at downtown, I think by Catholic Charities, they have a lot of farmers from all over the world who work in the community or have plots in the community gardens and are growing foods from their home country that may not be in our grocery stores. So, you know, can find some interesting new foods that you might enjoy as well.
Hey, Kristen.
Yeah.
It's Chelsea. Hey.
Hey, Chelsea.
I love this initiative. And, you know, I grew up in Berea, so we always had community gardens. But if someone in a rural community wanted to start something like this, where do you think would be the best place to start? Who should they engage with first? How could we get some momentum behind this in more, you know, spread out communities?
I think that the first place I would go to is the co-op extension offices. So they're across the state. There are a lot of huge initiatives with the state now and improving access and with the food as medicine initiatives and also connecting those with the farmers across Kentucky. So I think that the extension offices would have the greatest resources for getting started in individual areas, but even at the state level, I think there's a lot of different resources. There's so many in Kentucky that we can take advantage of.
Thank you. Yeah, I love that. And, you know, even just the thought of, say our garden overproduces our personal garden, share that with someone, especially an older adult that may have mobility issues that can't, you know, even do the raised beds. Are we as an individual being proactive in sharing our fresh, I was going to say yields, maybe it is yields, but are we being proactive in that as individuals in the helping field?
Absolutely. Yeah, Mona, churches. I'm not real familiar with the health department resources. Schools are definitely getting involved in those state initiatives as well. Yeah, those are some good resources.
So questions for Kristen or any reflections on how you might take this into the clinic, the community, or your programs? Yeah, Mona's encouraging us to talk to local coalitions. So something that Sam was talking about before we got started about her friend is a list of places in Louisville would be helpful. Yeah, so Phoebe, I think Metro and then some of the other resources that are earlier in the PowerPoint. I'll share this online, and it has the hyperlinks that you could go to some of the places in Louisville. But there's a lot of there's a lot of resources, it probably in every community, but the Metro, Jefferson Metro, and then library and the extension offices are really, really helpful. But Sam and I were talking about her friend is converting her front yard into a yarden, which is just a fancy way of saying some combination of plants that isn't grass. We have a garden in the right hand side of our yard that's all herbs and pollinator plants. So we have several different types of milkweed, and we have a lot of herbs. And so we've been converting our front yard into, well, it's slowly taking over, but really trying to make something that is both aesthetically pleasing, but also attracts butterflies and bees. And last year I think we had 6 monarch butterfly or caterpillars that we had turned into butterflies in enclosures. And this year we've had 2 black swallowtail butterflies that overwintered that emerged. So that was something that was kind of a cool thing that's emerged out of our garden is, basically finding caterpillars and then letting them turn into cocoons and emerge is pretty neat process. Anybody else have comments, questions, ideas of how you might take this back into your community or back into your work?
And I do think I want to just piggyback off of what Justin said and add that I do think this is really a lot of times I think we think, oh, in our rural areas, this is more feasible. But even for those of us who live in Jefferson County and Louisville, this is something that we can engage in. And I'm going to put in the chat, there is a under on the Metro page, a community gardening page. So I'll share that with you all.
So I'm not really sure what happened, Susan, but your question has been broken into individual chats by letter. What suggestions are you able to unmute?
I was gonna say, what suggestions do she have for someone that may be in like a apartment or a small senior home or something, that have limited space, but would like to have that type of outdoor experience?
Yeah, so that's a good question. A limited space can be a big barrier. For apartments, if you have, even a small outdoor area like a patio or a deck or any space that you're able to container gardening or even you can. I've seen people take pallets, like wooden pallets, and lean it up against the wall and have they make things like that as well. But pallet is a good more affordable option. But if you have that space, if you don't even have that space, there are so many community gardens. So if you have transportation or if there is one in the area, that's another great option. Um, and even a windowsill, like I said, even if you're not able to have a big garden, if you have a windowsill, you can line it up with herbs. Of course, it's harder to do with a lot of vegetables, but that's an option. I know when I was in an apartment for a while, I had lights and I liked I grew some things inside the apartment. Um, so yeah, it can definitely be a barrier, but I think that the community gardens can be such a great resource.
Christine comments that she's sorry she can't turn her mic on, but she works in a clinic that serves people with HIV, and a good number of them were diagnosed early and didn't plan to live long. And as they're growing older, their bodies aren't always in the best shape, but this gave her some good ideas to help, on multiple levels of functioning and to help with depression.
That's wonderful. Love to hear that.
Tiffany, yeah, go ahead.
Hi, I'm kind of in the middle of stuff or whatever, but I did hear about the balcony space, and I actually started a balcony slash patio garden last year. I got turned on to, I was curious about how to maximize my little space or whatever, and it was kind of like the beta program, the beta program to see how stuff would work. But I actually have something called a garden tower. I want to say garden stalk. Green stalk. That's what they call it. There are a number of different companies that sell these things, and it's vertical. It's a vertical garden tower where it has different pockets or something along that line. You place soil in the container or whatever, and you stack them on top of one another. You seed in them, water them, and all that kind of stuff or whatever. So that's another way in order to kind of you know, optimize your space, your small space, because it's something that I was really, really interested in doing. So that's another way that you can actually go. Of course, if you don't want to go to these fancy websites and pay in excess of $100 some odd or whatever, you can go to your Lowe's, your Home Depot, or even order stuff from Amazon for pennies on the dollar. They have similar outfits that you can stack and make towers out of and that type of thing. I think there's even stuff, or at least there was last year, at Dollar Tree. You could actually purchase or whatever containers of same built similarly, but that's just another idea. So
Absolutely. And I'll add on to, if you don't have that outdoor space, I was just thinking about my mom even has one that she uses indoors. It's a tower, but it's like an aquaponics garden tower. And so she's able to grow some things indoors using that as well.
Yeah, I kind of want to echo what Tiffany was saying about the expense. I think, with a little ingenuity, you can really do a lot with a little. I watch my mom do this a lot where she'll find, ideas, oftentimes online and take them and, run with them in her yard and do different things where she's, crafted, and the crafting, for my mom's retired. And so to watch her find, ways to stay engaged, it's creative and it really helps with her, just staying engaged a lot of times. Other questions about or comments about ideas to take this into your clinic or community or programming you might consider offering?
I think this is a really good idea to implement for older adults that live in like rural areas. Throughout my time, doing like home visits with older adults in past jobs, typically they always have like the proper space to start a garden, and I think that would just help out so much with the feelings of loneliness that are often happen in this area. So, and I think gardening would be just a really good way to keep older adults engaged. I know with my grandma, it made a world of a difference for her.
Yeah, Lisa.
Hi. So I think gardening can be intimidating if you have had no experience or didn't grow up with, your parents or grandparents gardening. And so I remember I would have students talk to me about it and I would say, I have no idea, but I'll get you the answer. I do not have a green thumb, right? And so I appreciate that comment about one herb at a time because that's for me. I did cilantro and then I was like, wow, this is great. And then using it in foods and it just, then I would have those conversations with students. And so I think even for all of us working with clients and things like that, having that if you don't have that experience, just trying something like that and then, having that confidence and feeling comfortable having those conversations and making recommendations that, hey, go ahead and give this a try, I think is good.
Thank you for sharing that, Lisa. Yeah, that those small wins can really create change.
All right, any other questions or comments? Thank you, Kristen. Appreciate you being here. Hope you have a great rest of your safe trip home.
Thank you so much. Thank you all for being here.
All right, so if you would like to access anything related to this session or previous sessions, project or the iEcho platform has been updated, and I recognized in the last couple months they had updated it, and it was hard to find things, and they have updated it again, and it is easier to find session material, but there is an extra click. So when you log into your account, if you'd like to ever see the session handouts, if you'd like to see the session recording for today or previous sessions, when you log into iEcho and you click View Details, it will go to a page where it shows you all the previous sessions. And each of the previous sessions will have session material underneath it once you go to that second page. So if you ever, again, want to see the handouts, or if you want to see a recording, once you're logged in, if you click View Details, you'll see previous sessions, and the previous sessions will have the recordings and the session PowerPoint. So I apologize if you visited in the past and it was confusing. They've updated their website, and hopefully they'll continue to fine-tune it and make it easier to navigate. So I'm going to turn it over to Chelsea to talk about the KCHC.
Hello, everyone. I apologize. I have a kid in the background, so if you hear anything, I'm going to go ahead and apologize in advance. And there is no way that I'm going to do this as well as Miss Mona does. So bear with me. Our purpose at KCHC is to train and empower stakeholders and community members to provide hope and education for their communities. So we want to support the work that you are doing already in your communities, and how can we help support that and partner in that? So someone talk with me about, what did you learn today? What did you gather? What did you find as your biggest takeaway from Kristen's topic on gardening? And I know we've already had a really good discussion, but anyone care to share?
I want to recruit everybody in my neighborhood that is turning their yard into I'm using the word garden, but everybody that is transitioning from grass to native plants and pollinators, I want to create a collective of people that are recruiting other people to do it, because I would love to see like my entire neighborhood, basically covered in flowers, because flowers are just a lot more pleasant for me to look at than grass, or at least there's a mixture of grass and flowers and plants. But so that's something that I've kind of been inspired to think about doing.
Yeah, Justin, I was like, you know what? Let me get on Facebook and see what momentum I can get behind this in Corbin. It really was like, I know throughout our community, there are what used to be community gardens. I think about where Jackie goes to school, on the back side of it, there's a community garden. And I'm like, where how could we tap into that? How could we revitalize that? Because I just think it does bring such a sense of community, right? Like, I'm doing something and it's giving back to everyone else. If I pull one weed, I'm helping somebody else out. And the fact that others could just go there to get food. I know we talked about this, and I would love to learn more too about how can a community garden support the unhoused population, right? Could somebody swing by and pick off a cucumber and have a snack for the day? I think that's a really interesting idea that they, aren't necessarily working on the same constraints as a food pantry per se, but maybe in a pinch they could swing by. I'm like, this has caused me to think on different levels, right?
Yeah, I really appreciate Latrice's comment that the gardening isn't such a daunting or scary task to undertake. And Maria said that gardening can be accessible to all. The lady who started with one pot of herbs, yeah, I think making this accessible is really important. Susan?
Yes. So I'm like Chelsea, my mind is just going 100 different places, but I heard someone talking about a study just yesterday about the best predictor of relationships between grandparents and their grandchildren. It didn't really have anything to do with maybe how often they saw them or, gifts or anything like that. It's just when they were with them, did they give them undivided attention? Did they, really connect with them, make them feel like they were the most important person, like in the room? So I'm thinking about how all of the older people, that you grew up with, gardening was just something that they did. And compare that to with, I guess, grandparenting now. I'm a grandparent, but you know, it seems like to me we're really missing the boat sometimes about these intergenerational activities. From a kid's standpoint, we know that they need to be off of their devices. They need to be outside. They need to, they have so many better outcomes when they are not tied to their computers. And we know that older adults have so many better outcomes, and their self-esteem, their self-confidence, their competence, increases when they are, asked their opinion, when they feel relevant. And I just feel like this would be a great opportunity for, on both ends, that the older person can, those activities, that generativity, to feel like you're passing something down to a younger generation, and younger generation get that undivided attention. So, to me, it's like a win-win.
Yeah, yeah.
Susan, I'm sorry, Justin, go ahead.
No, I was gonna say I love that intergeneration. That
Yes.
intergenerational piece is really beneficial for everybody.
Like, Susan, you just took me down a trip. I lost my grandmother last February. But when you were talking, I remember going with my grandfather to pick green beans, coming home, it being early the next morning, like they, 5, 6 o'clock in the morning, they'd be on the front porch stringing green beans, and then she and I would can those. And so I just feel like it's such a yeah, thank you for that, because that's such a good point. It goes beyond the garden. And maybe that's another topic we need to talk about. It goes beyond the garden. I really think that is awesome. And I would love to read that study. So if you could put it in the chat or anything, or even if where you heard about it, I would love to take a look at that. Other
I'll
people
have to find it.
Okay, that's totally fine, and no rush. Listen, everybody's got a lot going on. I love everyone's been putting in the chat about how it's one small plant such as an herb can really get get people to buy in. Nicole said that when she worked in Savannah, she worked with food pantries. One of the pantries started a small container garden that was available for neighbors to supplement their bags received from the pantry. And that's awesome, right? We know about canned foods, we know about processed foods, and we know the benefit of fresh foods. Riley is talking about how can we source food for the culinary kitchen at Traeger. I don't know the exact answer to that, but I would say Kristen and Nakia are probably looking into that. Um, and Misty, yes, would love to help with that. Carla said that she works with a couple of seniors that live in small apartments but do gardening containers. This does give them purpose and confidence to see something they are growing and consume or give away to others. And I love that. I remember, even if it's one pot, if someone doesn't have a patio, one pot of tomatoes by the front door, it can go a long way, right? So, how will you share what you've learned today with your community? Um, Susan and I started, and Justin talked about some ideas we had for engagement, but is this something you can see yourself bringing up to clients? Is this something that you think your organization could lead an initiative in, or how will you just share about the benefits of gardening overall? Any ideas? I'm no gardening expert, so I couldn't really go out and give a presentation like this, but I do feel like I can talk to my neighbors. I have an older adult that's a neighbor that loves to garden. And I could say, hey, we talked about this today. What if I helped your garden and we shared some of this? We shared it with the community. And as a therapist, it would be a good tool to use as for coping. Yes, absolutely, Christine. I love that. Anybody else have any ideas?
Yeah, Lisa.
Chelsea,
Yeah.
I-
I'm sorry. For some reason, I can't see anyone but the speaker. So if you have your hand raised, I'm sorry.
Melinda, you're breaking up.
okay. I'm sorry, I'm driving, I'm working. But yes, I used to take my kids um to the assistant living, and we actually volunteered and brought the garden to the facility. And we also used it as a homeschool project for the kids. So, but I will tell you, like, we had great success with that. We just had to bring it to them, and they enjoyed every bit of it. It was like most of them were retired farmers, and they actually got to work and till and do everything out in the garden. So it was successful.
I love that, Melinda. Our activity director, when I worked at the long-term care facility, she really tapped into that. So there would be times that we would go buy like a bushel of beans for the older adults to string just because they loved it. It wasn't even like a chore to them. It was more of a pastime. And so I love that you're taking the idea of taking it to them. I think there could be a lot of benefits in that.
Yes, and can I ask you one question? Is the Project Echo also for like surrounding counties, or is it just for the Louisville area?
No,
Could we
it's
bring it to
statewide.
like Meade, Hardin,
It's
and stuff like that?
statewide. It's
Okay,
really, honestly, it's nationally, internationally, it's everywhere.
awesome. Okay,
Yeah.
thank you.
Yeah, no problem. Thank you for sharing. Anyone
Okay.
else? As a nutritionist, I can mention this in the programs with horticulture agents and to actively begin growing with older adults. I love that, Nicole. And then Chandler's going to talk with his family, make up a brochure to hand to patients and clients. I really like that, Sheila. Give them something tangible with a few little tips of you can start small. And what does that look like? So this is awesome. Thank you all for sharing.
Also, I mean, volunteer opportunities. So, in my area, I'm in northern Wisconsin, so our community college has a farm. The K through 12 has their own farm as well. And so they're always looking for people to come out and help with potting, doing different things with the farm and the garden there. So the community garden as well. So any opportunity to volunteer, workshops. I know you mentioned doing presentations and things like that, but even just small workshops, showing how to pot, how to do those kind of things would be helpful. So volunteer opportunities.
Yeah, I love that, Lisa. Like, are we making ourselves available to take advantage of these opportunities out there? Are we giving back? I love that. That's great. All right. Others have said it'd be great to involve grandkids, youth with the senior centers. Yes, absolutely. If you have a club, maybe at a school that wants to reach out to the senior centers to support that, that would be really awesome. Um, Local library has a seed program. I love that. If you want a truly good heirloom tomato, check out your local libraries because they usually have a lot of seeds. So I love that, Maria. That's great. And then Austin said, I have a few clients that would be prevented from growing their own herbs or plants because of where they live. Are there any suggestions for those who wouldn't be able to travel to a community center but would still like to participate within a housing authority? That's a great question, Austin. Anyone have any suggestions or thoughts? Maybe where they live is a barrier and transportation is also a barrier. Any ideas? I really think there, in my mind, right, in an ideal world, and a representative from the community garden could bring it to the clients, right? And not only would that be a time for them to socialize when they do the drop off, they're also getting the produce. So that would be like an ideal, right? But I do think that there would be volunteers that would be willing to do that. Anybody else have any ideas for Austin's scenario? And maybe it's that the housing authority won't let them do it within their, apartments or dwellings, but they could always do it in a communal space if that would be allowed. Any any other suggestions for Austin?
Austin, I have a question. With a housing authority, do they have any kind of ombudsman program or any kind of advocate that could, maybe like or a council that could maybe help them advocate for themselves? I'm just, I'm really, sadly ignorant of that system. I would just think that there would be at least somebody that can help, people who are residents advocating, and get something that seems, I can realize that there's probably some things that aren't reasonable, but, it seems like giving people access to the ability to grow plants would be a reasonable.
It's really different based on the housing alliance. You would think that where they're all housing authority, I said housing alliance, where they're all housing authorities, that there would be a cohesive kind of rule to that. But all of them really vary. I've had some where the housing manager has ultimate say, and then I've had others where it's like a communal say. I actually had a specific example where plants were considered dirty or allergens, and whether that was the case for the specific plant or not, they just weren't allowed as a general rule. So I didn't know if there was a policy or maybe an advocacy template that could be used to give to these organizations.
That's an excellent question, and
Yeah, I love that.
I might just do a little homework and see if I can find anything because I think that that's why I asked if you were in a long-term care facility, you would have an ombudsman and you'd probably have a council within the facility that would that could help advocate for things like that. But I don't know. I'm assuming this is a federal or state organization.
A lot of them are federally, they take federal dollars for the housing, but they're some of them aren't cohesive in how they run their advocacy system. So, like I said, it could be varied based on one housing manager or just what the consensus is among the building. Uh, Sometimes can be a very hard barrier to breach. It's more of convincing than it is actual policy.
Mm. Yeah, thank you for that question.
Yeah,
Yeah.
I love that. I think something else that I think maybe we haven't really talked about, but could we consider, would there be clinics or primary care offices that would allow something of the sort where someone may be already going for primary care, but is able to pick up some produce while they're there? So not an extra trip, but a trip that they may already be taking. Can we meet people where they are at? So yeah, Austin, that was a great question. And I think we need to delve a little bit deeper into that and educate ourselves as well. Anything else? And Maria said an indoor gardening system, they can be around $100 or so though.
Uh,
Countertops. Go ahead, Phoebe.
I'm sorry, I was gonna suggest that this remind me was because I'm a mental health provider, nurse practitioner, and it's remind me was like some of the letters maybe I wrote as a supportive for people who can have their pets, in their home for their mental well-being, mental health. So this remind me with that. So maybe that could be an avenue of like, I don't know, to grow their own thing in their home for their mental well-being, for their health, and maybe there is an avenue for that as their provider to write a letter or something. Maybe that's the only idea I have to help the situation.
No, I think that's really good, right? Because I can put some leverage behind the advocacy and the persuasion.
Yeah, yeah.
Yes, I do. I like that approach, Phoebe. I really do. And that kind of goes back to what Kristen was talking about this prescription for lifestyle medicine. And then, they could say, my provider really thinks that I could benefit from this. So I love that. Absolutely. Thank you guys. This was great. Great discussion. Carla said some of the housing complexes have resident councils made up of residents that assist in making rules and offering new activities for the residents. That's a really good recommendation, Carla. That is very true. Some do have those resident councils, and that would be great to get them behind it. I think that could really cause some ripple effects. Okay, guys, we have come to the time where we can share what is going on in our organizations, community events, any concerns you may have. I will say right now we are, and I'll put it in the chat, we will be having a Impact 4M session, and I know there's a slide about it later, so I probably won't put it in the chat. But we would love to have you all May 6th. We'll get to that here in just a little bit. But does anybody have any community events or upcoming meetings they would like to share?
I will say that I know we don't have a slide for Impact 4M. So,
Oh, okay.
we're
Okay.
doing a training on May 6th from 9:30 to 1, taking a deep dive into age-friendly healthcare. We'll use case-based learning. So if you would like to learn more about that, you can please email me and I can get you the information.
Yes. So please, we'd love to have you for that. And of course, we have a number. We'll have Project Echo next month. We all have all different kinds of programming throughout the state. So anytime you have any questions about that, please let us know. Anyone else want to share?
It won't let me drop any flyers in the chat, but we have a fantastic optimal aging scholar program where you can take a series of trainings and you can use this optimal aging scholar award to put it on your CV or your resume. Really great opportunity.
Community health specialist, do you also care to share about the steering committees?
Yeah, I can share. So in the Cumberland Valley region and the Barren River region, as well as the Kipta region, we've established a Flourish Care Centers of Excellence steering committee, and that consists of it's an interprofessional environment, so it consists of medical professions, academic, local government, and it's all about finding ways to remove barriers to improve transitions of care in older adults to help that process become more smooth. And for the Cumberland Valley one, we meet the last Wednesday of every month from 1 to 2 p.m. And if you give me just a moment, I will put the virtual link in the chat for you.
Yeah, and I'll have a slide here in just a little bit that has that information on it.
Thank you, Justin. Anyone else have any upcoming community health fairs, events that you can think of that you'd like for the group to know about?
Hey Chelsea, I dropped in the chat, but I just wanted to say I don't know if anybody is in the Barron River area on this call, but I'll be starting a diabetes self-management program class in Allen County on Thursday, April 30th at 10 Central, and I've got my phone number in there if you all are interested or know anybody around that area that might want to take the class. We still have a few openings.
Thank you, Heather. All right. Anyone have any concerns they want to share? All right, Justin, you're good. Sorry. We will let you all know that we have our weekly community health support class. It's education and peer support. We for our My Health Matters, and so does yours series. We have a number of upcoming topics. If anyone would be interested, yes, Jennifer, May is Older American month. So most senior centers will be hosting health fairs throughout the month. Thank you for that, Jennifer. So everyone be on the lookout for that. Again, we have My Health Matters coming up. There's a QR code. If you'd like to join us, you can. We can send you the link. We have a number of topics for the April and May. We have hiking. That kind of goes with gardening, getting outside. The life-changing power of daily walks, women's health, alpha gal, which is a ever prevalent problem. I feel like it's more than I've ever known in my whole life. And then we also will have a Memorial Day discussion.
No. That's Memorial Day. We'll be off that. It's a break.
Just kidding. Chelsea will not be working that day. Neither will Miss Mona. Sorry, Mona. All right. And then, like Heather said, we have a number of diabetes self-management program classes going on across the state. These are held via Zoom, so you can join almost any of our classes virtually for the series. It's a free 6-week science-based program to manage diabetes or pre-diabetes diagnosis. So please, if you are interested, reach out to us. We can let you know what classes we have coming up. And you can do that from the comfort of your own home. So yes, there's information on that. We also have our Flourishing Together program that is holistic lifestyle medicine focused class. Reach out to someone on the Trager team and we can let you know when our next classes will be. Miss Mona will let you know when we have them coming up. I do know we have a number of Flourishing Togethers over the next couple months, and that's a free 8-week class. We're learning ways to eat healthier, become more active, and how to manage and prevent chronic disease. Our Flourish Care, again, is designed to help older adults with multiple chronic conditions to improve life satisfaction through comprehensive care navigation program. We have our caregiver program, and that's for individuals that are caregivers for those of aging adults 60 or older. Our virtual friendly visitor program helps those that are dealing with social isolation and loneliness. And then we have our Pearls program, where it's to encourage active, rewarding lives at no cost counseling. So please, if you have any questions, you can access these telephone numbers and links through the IECHO website. And like Chandler mentioned, we do. I'm sorry, I have a cheerleader in my background right now, so hold on.
So, if you'd like to learn more about age-friendly healthcare, we would invite you to join our Optimal Aging Scholar Program, attending Project Echoes, our Impact 4M, completion of online modules, and interprofessional case management experience. Really, give you a deeper dive into age-friendly healthcare principles, and then you'll also participate in our Optimal Aging Conference. And then we also have a behavioral health primary care scholar program, really focused on mental health providers. A lot of the similar requirements, but basically you're focusing really on behavioral health. So if you have interest in either program, please reach out to me and I will connect you with the program coordinator. And then you heard Heather, Riley, and Chandler talk about the Flourish Care Centers of Excellence. They're really doing groundwork in these different area agency on aging districts to create committees. Chandler, Heather, or Riley, would you like to say anything about the Flourish Care Centers of Excellence and the work you're doing?
Yeah, so pretty much, we're focused on improving transitions of care in older adults. We're working with many different professionals in doing that. And I know in my area, we've focused on kind of alleviating communication barriers for in like the referral and admission process. And we're kind of working on a contact sheet where all the required information to make a referral or an admission will all be in one spreadsheet for our region to utilize, just to kind of make that process smoother and there's no delays in care for the patient.
Okay, thank you. And so when you see the slides, you'll see that the KIPTA area meets on the second Wednesday. The Cumberland Valley area meets on the last Wednesday, and the Brad region meets on the third Tuesday. So when you access the slides, you'll have the contact information for those program coordinators. And so our closing pledge, we're really going to be working together. And again, this is an invitation to all of you that if you participate in other coalitions, invite people to join us. Really working to create and engage community members and community-based organizations to empower our state to become a healthier and compassionate people. We really work to practice self-care and model healthy behaviors to our families, coworkers, and members of our communities. So do so appreciate you being here. Again, May 15th, Dr. Laura Morton is going to present Pulling Back the Sheets on Older Adult Sexuality. We do need a case presentation for that session. So if you are working with an older adult that needs a discussion about how to support them, please reach out to me because we'd love to have you present a case. And then we have our June session and our July session. So we hope to see you in the future. This is our session evaluation. I'm going to stop sharing just for a second so I can get the PowerPoint. Give me a second. I'm sorry. I need to get the.
Thank you to Justin for bailing me out there. We had a full-on cheer competition in the background for a second. But I also want to encourage you all. There's a few other things put in the chat, including the KAYAC, Kentucky Association of Community Health Workers, is looking for conference presenters. So please take a look at the chat and see if there is anything of interest to you.
Okay, so I have put the session evaluation in the chat. Also, you can use the QR code here. We appreciate you being here, and we hope to see you next time.